A very good evening to everyone in Asia. Good morning to those in Europe and North America. And thank you, Jai Ganesh and the AeHIN team for this kind invitation to be part of this really interesting webinar series on digital health that you organize. Today we are going to talk a little bit about a report that Jerry, myself, and Annabelle have been part of. It's on digital transformation for UHC and proposes a different kind of approach and framework for looking at understanding rapid change, particularly in country-level mixed health systems. So I'll start off with one or two slides of who we are and what the platform is, and the genesis of this particular report and the platform itself, and then hand over the baton to my colleagues, Jerry Bloom and Annabelle, and they will talk a little bit more about some of the learnings that have emerged from the report. And we will conclude with Annabelle talking a little bit about the digital transformation labs that have been proposed in the report. And then we would like to kind of open out the session to a more interactive kind of engagement where we would be delighted if participants could ask us questions and also maybe share thoughts, views, and comments about what they think about what we're proposing and how they would like to participate. So let's get started. So the mutual learning platform is essentially a platform for learning rapid change that's happening in mixed health systems all over the world today. It was catalyzed particularly during the COVID-19 crisis. And we're a global South-led platform with core partners that include the Public Health Foundation of India, AmRef Health Africa, the Institute of Development Studies, Sussex, and the Center for Sustainable Health Innovations based out of Singapore. We are essentially a group of health system scientists, analysts, innovators, working with collaborators in the private sector, technology innovators, governments, both national and regional, research institutions, funders, and international agencies. The platform's most recent offering was a report on the management of digital transformation of health systems, with a particular focus on the Global South. And that's what we will be talking to you today and sharing some of the learnings of this particular report. So what does the platform for mutual learning in a sense really do? Or what are our key objectives? The platform was really born from a series of consultations that we had that started beyond COVID and then continued. And it essentially explores mutual learning across sectors in health systems that include the private sector, technology innovators, governments, as well as several non-state actors who are increasingly playing a larger role in health systems capacity building globally. Some of the objectives of the platform include to support and encourage experimental learning and processes in health systems capacity, to build socially desirable policies, as well as actions around health systems reform that are both pragmatic and veer more towards implementation. We hope to document and draw learning from new types of partnerships that are emerging, particularly with the private sector and technology actors, that include issues such as scaling of technologies, better integration of technology tools and architecture, and new models of financing, particularly with non-state actors and governments. We aim to create and support opportunities for mutual learning between healthcare stakeholders within and across countries, which includes trying to better understand evolving digital health architectures. What do you mean by digital public goods? And this includes broader aspects like stewardship and regulation as well. And finally, we hope to develop new types of collaborative models with research as a center and other sector stakeholders for evidence generation to both inform learning around health systems, reform, and capacity development, as well as adaptation to rapid change that is happening in many health systems today. And technology is proving to be that major disruptor. We envisage researchers as catalysts for new engagement models among health systems stakeholders. So as a precursor to this platform and also to this report, the genesis of this report was really a series of multi-stakeholder consultations that began as far as back as 2018 and then went on to the end of 2022, where we met with over 300 senior government officials, leaders of private companies, technology innovators, and health systems analysts working in Asia, Africa, and Latin America. The initial set of conversations was really aimed at accelerating progress towards universal health coverage with a lens to see what multiple sectors were doing, particularly in response to the COVID-19 crisis. Many of the people that we consulted were based in countries with these mixed health systems, which had public and private sectors. And these were systems that were still struggling to provide universal access to safe, effective, and affordable health services. However, there was a hope that digital technologies could contribute to progressing this goal much further and bridging a lot of these crucial health systems capacity gaps that were emerging. And so we had an initial set of face-to-face meetings in India, Rwanda, Vietnam, Argentina, and Colombia. And then PHFI and IDS led additional consultations on digital health, which were a mix, a hybrid. And these included lessons from the response to COVID-19 crisis, panel discussions on India's own digital health architecture with the legal firm Ikigai Law, high-level discussions with leaders in digital innovations and health system strengthening that was part of the Health Systems Global Conference in Colombia, Bogota, as late as 2022. So these were wide-ranging discussions. And while many of the consultations included a diverse sector of stakeholders from many industries, one of the things that we did observe is that a lot of the people whom we consulted were quite unsure about how to manage this rapid process of change. How do you manage technology operators who are now intrinsically embedded in health ecosystems? How do you manage the creation of these digital health ecosystems? How do you manage technology as a public good and new technologies like artificial intelligence that were increasingly going to dominate the way we handle data, the way many kinds of health services are being accessed and provided. So some of the early learnings that really came out of this were that in many countries, private and non-state technology providers did contribute substantially to COVID-19, but many of them lacked an effective governance arrangements to ensure that service provision was really accessible to all population groups. There were these emerging digital gaps or digital divides that still need to be addressed. The evolution of digital health markets would eventually hinge on the influence wielded by many, many stakeholders, not just a few, and different stakeholders. But however, the legitimacy of the regulations and architecture and stewardship that we aim to provide will also rest on that collective willingness to adhere to them by many of these stakeholders. And that is eventually going to be very pivotal. There is a recognition of the need to move past proof of concept projects towards integrating digital innovations at scale and involving new types of collaboration between the public sector and digital health companies. But what would these new engagement models look like? And what kind of stakeholders do we need to begin to better understand these engagement models? There was also, interestingly, a very conspicuous absence of citizen group involvement that was noted in many of these discussions around digital transformation of health systems. And this was a very big gap and actually eventually led to the genesis and the writing of our report. And finally, there was a very large difference in the understanding and perspectives of stakeholders. Technology innovators had little knowledge of the organization and governance arrangements of health systems, and health policymakers had little understanding about the digital industry, the rapidity of change, and how do you manage some of the factors that were influencing these rapid emergence of innovations. So there was a need for a multi-stakeholder approach to better understand many of these developments that included and involved technology at multiple levels in health systems. The consultations produced a series of reports. You can find them at the link below. And it eventually led to our most recent report that we will be presenting to you today on digital transformation for universal health coverage. I'd like to hand over the presentation for some context setting and key learnings to my colleague, Jerry Blue. So over to you, Jerry.
Well, first, it's really a pleasure and honor to be able to present this to this group. I think the first thing I would say, and what comes out of those consultations, and a message I'm sure you're aware of, is after years of developing digital health and building awareness, we are now getting closer to the time when this is really going to lead to changes at scale. And this requires new ways of thinking about how to manage this change process. So a bit about the context. Well, we all know there's already a WHO strategy on digital health. In many countries, the digital health sector grew rapidly during the pandemic, mainly because government was looking for rapid ways of coping with the crisis. But what is also important is that digital transformation will entail new types of partnership. And that's partnership between the public and private sector and between the health and technology sectors. So quite new arrangements need to be put in place for these changes to take place at scale. At the same time, many countries lack their regulatory change and government capacity growth has lagged behind the changes in technology. And there's now a need to put in place appropriate governance arrangement that can support rapid change, but also protect against problems. I think what comes out of it, and I will say it, but I'm sure you all know this, some of the challenges and risks that governments and innovators need to think about. First is the lack of incentives for local innovation. That's the case, I'm sure, in some of the countries you're in. There's a fragmentation of services due to lack of interoperability and poor coordination between the private and public sector and tech and the health sector. Danger of increased inequality in access because of digital exclusion or the price of care. Of course, there's also the possibility of improved equality. And there's experiences of poorly performing partnerships between digital companies and the public sector. This is about risks. Obviously, there's a risk that the treatment algorithms could be influenced by stakeholders such as suppliers of drugs and diagnostic equipment. There are risks that we all know of breaches in patient confidentiality. As data are used and there's an increasing analysis of big data, economies of scale come in, and the danger of domination either by government or large companies. And I think the key message is that now as we move to major change, we need to really have a process that not only recognize the risks, but take action to mitigate them. And this involves all stakeholders need to build a capacity to participate in this transformation process. And that's the main conclusion of the report. How to do it. I think the first point is there are no blueprints for transformation. There's no blueprints. And I think this came out very much in the consultation with senior people in India, where the message was, there's no blueprint to import from outside. We're going to have to develop the appropriate approaches as change is implemented. But what does this mean? I think one of the key things that came out is there's a very big gap in understanding between the tech innovators who understand the tech sector, but have a very sketchy understanding of the complex health sector and how it is operating. On the health sector side, as all you know, there are many people that just wish this wasn't going to happen and have very little understanding of the issues and the factors influencing the tech sector and the direction of innovation. So step one, So step one is that we need to build just a common understanding that the tech sector understands health and health understands the tech sector. If there's no blueprint, we need a learning by doing approach. Identify problems, test strategies, learn from the strategies, and build the capacity of all stakeholders to participate in this change process. And finally, support mechanisms for local learning, but also mutual learning between countries. And I guess that's something your organization can be engaging with. Now, this isn't just about digital health transformation, but it's for universal health coverage. In other words, an approach that leads to more equity, not less. So an inclusive approach. And step one is really all parties need to agree on the basic objectives. In this case, it might be about making progress towards universal health coverage, centering it on pursuit of equitable outcomes. We need to find mechanisms to involve citizens. One of the big dangers to digital transformation is the danger that people will simply not trust it and may not use the system. So to avoid misinformation and lack of trust, we need to involve citizens. And this includes the perspectives of the vulnerable and marginalized groups. And finally, we need to promote independent analysis of what's working well and what are the problems so that there's a learning approach and that the regulatory arrangements are built appropriately. I mean, we gave some thought to, well, what does this mean in practice? And I will pass over to Annabelle to talk a bit more about it. But the way we have articulated it is rather than try to transform the whole system or think about things at scale, that we need a process of an experimental-led approach for just digital health transformation. And it involves really engaging with the ongoing processes of change to have all parties identify challenges, jointly decide priority collective actions, agree then roles of responsibilities for everyone, government, tech innovators, the large companies, citizen groups, and then monitor progress and generate learning. But I'll pass over to Annabelle to say a little bit more about the experience of Transformation Labs.
Thank you very much. And again, for me, it's a pleasure here and an honor to be with you. I will talk to you with you a little bit more about the idea of transformation labs, which are the processes that we are proposing to deal with many of the challenges that Priya and Jerry mentioned. So just to begin, a very short definition of transformation labs are highly facilitated processes, multi-stakeholder spaces of interaction and dialogue, aimed at co-creating new visions, understanding, practices, interventions for transforming systems. So that's the kind of general idea. And just to give you a better understanding of what these processes are, I will tell you a little bit of the history where they are coming from, because the idea of transformation labs started in relation to discussions about very challenging sustainability problems, which involve tensions between different kinds of stakeholders as a way to address these tensions and these problems and promote changes. So that's why these processes are very well equipped and to deal with situations in which we have, by definition, tensions between different actors with different understandings about the problems, with different views, and so on. So this is where it's coming from. And basically, there are a lot of tools and methods that have been developed to work within these spaces that are created to promote changes, and most of them really work in the direction of trying to build agreements, common understandings about the problems, mutual and common understanding, and points of action, basically. These are not spaces which are created to create consensus necessarily, but are much more about co-deciding actions, how to move and how to change the systems to promote the changes that are required for address the main challenges. The starting point of transformation labs is a commonly an idea that is common to all the participants about which are these challenges. So this is quite a lot of the work is about the co-identification of these challenges, and then very much about deciding the actions that need to be taken together to address these challenges. In the space of health and digitalization in health, some issues that are very important to take into account, and this is based on work that we already done with some in Argentina and in other countries, starting to experiment with the idea, but also in previous interventions and research projects in which we have worked with the idea of transformation lab. It's very important that in these transformation labs, we have actors which belong to different parts of the systems and not necessarily all of them from the health sector or the private sector, but also like Priya and Jerry mentioned, it's very important to have citizens involved and users and those that might be blocking or might be resisting changes to have the opportunity to take part of these processes and also involve their views in the process. So this is a very important thing, and the process should very much aim at building these unexpected alliances or unpredicted alliances between different kinds of stakeholders and actors that get involved in the process. The other thing that is very important is that the spaces are created for experimentation, to try new things, new ideas, and so they have to be very much oriented to changes and to innovations and how to promote changes to address the challenges. So there has to be a space for experimentation and to bring different views in relation to the impact that these changes and experimentations might have, because there will be actors with different views and they will perceive risks of these changes in different ways, and all these views have to be incorporated in the process. And the aim has to be to develop some joint proposal and ideas for change to address the challenges that were jointly identified. And why, before mentioning some of the learnings that we have done through applications in practice of ideas from transformation labs, just to tell you that why we think these processes could be potentially very helpful in the context of digitalization and in the health sector. The reason why we think they might be very useful is because they are precisely processes that are designed to deal with systems that are facing difficulties for changing. So there are different parts of the system that are blocking change. So these processes are precisely designed to unblock some of the changes, some of these blocking forces. And very importantly, bringing the views of different actors, but also helping to direct some of these changes. And so to kind of get an incident on the process of changes that are already taking place. And so that's why it's very important from the very beginning to engage with the existing ongoing processes of change. And that's part of of what it has to be considered in the design of these processes. So to finish here my intervention, just mention some of the learnings we have done from applications is that, as I said, focus on innovation and learning, not necessarily on bringing to consensus building, the focus on promoting changes and with a view that these changes have to be systemic. So even if we, in these processes, focus or begin focusing on something very specific, very small, this has to be always we thought in terms of how this will impact at the system level, because these changes, even if they are small, they will have to be connected to other parts of the system. Then it's very important to be very careful about who will lead the process of the transformation labs, because this is a very sensitive who organize and lead the process in terms of being able to involve actors in different parts of the system. And also it's very important to decide very carefully who will be involved in the transformation labs to then for these processes to become relevant and have an impact. And then the last point, which is very important, is that these are not one-off events, but they have to be ongoing processes. They have to sustain on time and involve different actors in key parts of the system on a permanent and sustained and permanent level. So I will leave it here. I will be open to questions if there are questions about these methods.
Thanks, Annabelle. I'll just kind of wrap this out, and before opening it out to the rest of the forum, to talk a little bit about how we are envisioning some of these labs over the next year or two. So transformation labs are being explored in India, Kenya, Zimbabwe, and Bangladesh. And just for example, some of the partners in India include CCAMP, which is an India-based incubator slash a technology and innovation developer, which is partly funded by the government of India. They're kind of Bangalore-based entity, and their challenge that they posed to us was that they are involved in developing beyond prototype a slew of innovations that address different challenges proposed to them by different states, and most of their responses are essentially technologies that kind of address some of these challenges. However, I think the area where they are kind of stuck in right now is that they are producing all these prototypes. They are going beyond these prototypes, but they are still challenged when it comes to scale and more seamless integration with other state health systems. And therefore, they want to kind of have a lab that begins to kind of explore some of this work that they're doing. Similarly, in Kenya, we were approached by a company called HealthX. They're a mid-market company that provides telemedicine and teleconsultation services at the primary level in Kenya. And their issue for a transformation lab was really across 3 or 4 areas. One is that they really wanted to explore Kenya's regulatory environment, standards and guidelines for digital health. They were interested in looking at where and how telemedicine is evolving. They themselves have been at the forefront of engaging with the development of some of these guidelines. And they were also very interested in new financing models for telemedicine models in Africa. How does the state begin to engage with some of these technology operators? What kind of new partnerships can come about? And how do we begin to look at engaging digital operators as a part of mainstream healthcare provision? So what are the financing models that could really come about? And finally, they were also very interested in looking at behavior change across stakeholders to accept digital health solutions as a component of UHC. And similarly, we are also speaking with a consulting company which has been working with digital solutions for many years in Bangladesh called AeHIN, who are also planning a digital transformation lab that really looks across 6 blocks in trying to explore, the kind of digital tools and technologies that are currently being employed and deployed in Bangladesh across primary, secondary, and tertiary levels. And the purpose of their workshop was really to build a better understanding and analyze data and priorities for action to enable stakeholders, which is to actually bring citizen groups into larger conversations around health systems transformation and digital transformation, nurture trust among all actors, and essentially deliver on strategy. So agree on a common strategy to begin to look at digital transformation at a more holistic level. So these are just examples of some of the conversations that we've been having with entities across these countries. We're also, of course, in discussion with funders, governments, and international agencies on insights from the platform's consultations and their implications for the priorities and strategies of many of these agencies themselves and how they are hoping to look or understand digital change. that includes entities like AeHIN, which kind of works across the region. Jerry had a very successful meeting in Brazil with the government of Sao Paulo and with leading researchers in digital technology and health policy to discuss future collaboration in Latin America, particularly with the different kinds of digital entities that are emerging, and what that would really mean for companies as well as the public sector interacting with many of these companies. So finally, I think we'd like to leave this session with two questions. Essentially, how could a platform like the Mutual Learning Platform and the Digital T-Labs support and inform the strategic priorities and activities of AeHIN's own stakeholders who deal with government departments and other agencies? How would this benefit you? How would you like to use a platform like this? Does it make sense to the kind of work that you're doing across the digital space? And are there any key questions that AeHIN is themselves looking to investigate that this platform could eventually help catalyze? And perhaps we could organize a range of T-Labs in the Asian and regional context that begin to address some of the emerging challenges in digital innovation, but with a much more pragmatic lens rather than an objective exercise. So I'll stop over here, and I'd like to kind of open the forum to questions and clarifications. And we would be delighted to hear feedback from many of the attendees over here. I think Jay already has a raised hands, but we'd really like to welcome questions, and I'm happy to play moderator and maybe direct questions to Jerry and Annabelle, and maybe if I can address a few myself. So over to you, Jay. Please go ahead.
Yeah, thanks, Priya. A couple of questions and also some observations from what AeHIN does. One question is like, the digital transformation is a topic that also sometimes varies in how the country's governance is also placed. Because like a country like India, which has a federal structure, the challenges or opportunities could be different from other countries. Like, how did you find in your work? Like, did you find when in the countries with the federal structure, was it like something like from your studies? Like, was it something different from other countries? That is something that I wanted to ask. And then another thing is like the T-Labs, like, it's very interesting for us. Like AeHIN does this kind of coordination and convergence through our convergence workshops focused on digital health. Of course, like we let the MOH, the Ministry of Health, take the leadership. And then we bring together a variety of stakeholders in the country to basically bring in multiple sectors, because as soon as it is digital, but it's not only the Ministry of Health, and then there are other ministries also involved in terms of digital health, like for example, Ministry of Finance and Planning, or Ministry of IT or Telecom, and then some countries even have the Ministries of Digital Development or Digital Economy. So it varies. Like we bring together all such relevant ministries apart from the other Ministry of Health, and then other stakeholders like donors, development partners, academy, everybody together to see the national big picture in terms of digital transformation in healthcare. And we help the Ministry of Health, if there is a national digital health strategy, how to implement it, how to operationalize it. If there isn't, then we actually support them in developing one. So this we achieve it via our convergence workshop, and then you might know about it already, and then we will also share the links about our convergence workshops in the chat. But my question is like, have you looked, what is the difference in a country which does not have a federal structure and does have a federal structure? And then also, have you also looked, does the mandate of the T-Labs includes work on regulatory sandbox? Because I'm just out of an event focusing on AI in LMICs. And then many countries that both Africa and Asia who participated, everybody talked about how the lack of regulations and then the support they need, like, regulations typically take a long time in terms of data governance to begin with, and further onto AI. So what will be the mandate of this lab? Like, do you also think of working together with the countries to set up some regulatory sandboxes, or how do you support development of regulations? Because that's a big topic, and then it takes a long time. Thank you.
Thanks, Jay. Actually, the first question on, the how does this work in countries with a federal structure with vis-a-vis a non-federal structure? Maybe I'd like to direct that at Annabelle, because she worked in Argentina, and she's worked extensively in Latin America, where the governance structures are very different across the country, across the continent. So, Annabelle, would you like to take that question? And then for the second question on regulation and convergence, and the kind of questions that we are addressing or attempting to address, maybe I will turn that over to Jerry, because he's also involved in a lot of the stewardship work that he's doing with WHO on this as well. So, Annabelle, would you like to start?
Yeah, thank you. Yeah, now just first to say, in terms of the methodology of transformation labs, it shouldn't be thought as a way to solve all the problems, but more like a way to entry in a very complex and complicated process of change, in which we want to start to help to get direction to some of these changes and unblock the forces that are stopping changes and make the process more inclusive, if you will. So it shouldn't be thought as something that will solve all the problems, but more like a way to entry in a already ongoing process of change, with all the complexities that this process has, as a way to help to redirect some of the processes in more desirable directions. And so that's, having said that, because then as the second important point there is that who will convene. So these transformation labs is a very important thing. We are not necessarily thinking, and it's not necessarily the case that will be the government that will convene that, but it could be, and it could come as an initiative from other actors within the system that are involving different other actors in the system, including the government. But it could also be initiated by some government agency, but again, it will be an agency and not the whole. And so you will still have this challenge that you have to involve other parts of the government. And so this brings me to the issue of federal and countries versus non-federal countries. And on that, because I have done a lot of work in Argentina, that is a very federal country. Each province has kind of autonomy to decide their own regulations and so on. So it's very difficult to sometimes coordinate policies at the national, the provincial, and the very local level. And so the way it depends there where you are starting. It might be that in this particular transformation lab that you're organizing, you are doing it at the local level, and so you start there, and then you do learning processes that then can be translated to the provincial and the federal government. Or you might start at the federal government, and then of course you will have the complexity that when you try to go down to the local levels, you might have different regulations, different stakeholders, different set of issues. So in the kind of federal setting is a very complicated one, but is where you have to decide whether it's better to start at the very local or regional level, or go for the national level. But it depends a lot of the stakeholders that you are beginning with to start to organize these processes at the end of the day. So I don't know, I hope I responded to the question, but if not, I can go back happily.
Thank you, Annabelle.
Thanks, Jay. So I think the second half of your question is the question around national digital health strategies and how they kind of lead up to the creation of regulation and stewardship of digital architecture. And I think there's a lot going on, including countries like India. I think the G20 was a classic example of the launch of a national digital architecture and digital health policies, including the health data law. And there was a lot of parsing of that law subsequent to its becoming a bill. But I'll allow Jerry to kind of handle that question as to how the labs could potentially look at some of this. And part of this is also what we're trying to explore in Kenya as well, where there is no common regulatory law or digital architecture that has been established by the state. And what Health Act actually wants to do is to actually create conversations around that with the government. So over to you, Jerry. Maybe you can expand on that a little bit.
Well, actually, thanks for, as you mentioned, I've been involved in the advisory group to WHO on governance of the private sector. And I think what's come out is that there's no blueprint model that we know is going to work. So I think where activities like a transformation lab can help is to identify areas that really need action, to bring all stakeholders on board, because you have to bring up what are the positives of a change, but what are the risks and negatives. And then as you implement regulatory reform, to ensure that you're testing the outcomes. So I would see this not as a mechanism, as Annabelle said, to get a consensus on what a new set of regulations should be, but as part of the learning process of developing appropriate regulatory arrangements. And I think this is going to be the challenge as you try to hold meetings around regulation, is that there isn't a country that has the model regulatory system that all countries in Asia can adopt. So they're really at this stage, we need to learn what works well and what are the problems. I think I'd leave it at that and see this as, it's about a learning process, but involving all stakeholders. And the same thing is happening. And the other thing I think WHO needs to recognize is the degree to which this is involving the private sector. And so the problems that working group in WHO are dealing with around governance of the private sector apply to digital health transformation.
Thanks, Jerry. Any other questions? I think I can see one or two on the chat, but would anybody else like to ask any questions or clarifications or even thoughts or comments on what we presented today, which would be really valuable? Okay,
Priya,
so
I think there was one question from Dan Rosen from CDC. I remember seeing that question. Okay. In the Q&A section. Cha, can you repeat that? I think he was asking about the contact details of those labs. I think there was a question I saw from Dan.
Yeah, this is Dan. Priya already said she would reply, so I appreciate that. Thank you, Priya, and thank you for acknowledging the question.
Great. And I think there's one from Alvin. Yeah,
Alvin as well. Yeah. Just now I'm seeing that.
How can end users tap the T-Lab methodology? I think there's a lot of interest in that. So Annabelle, would you like to take that? And then I could also go back to Dan's question on the T-Labs that are planned. And maybe what we could do is we could actually send out information on these labs to the AeHIN group today, on all those who attended to this webinar, so that they could actually maybe see if they wanted to participate in the lab or actually see how the labs are actually progressing. So Annabelle, why don't you take that question, and then Jay, I'll come back to you after she's done.
Yeah, okay. So yeah, now just to say, of course, this is a relatively new idea. There are some things that have been written from applications in different contexts. I can share some material of what we have learned from these applications. There are a few things that I could share. But then what is interesting is that we have started to experiment and to really think about how to apply this set of ideas and methods that were originally developed in a different context for digitalization and health and the challenges of digitalization in health very recently. So we have some things that we are and we could be able to share, but we are starting to really experiment with it, and we are in the middle of kind of learning how to really apply and the new insights that we might derive from applications in this context. But so I will share what is available, but at the same time, I just wanted to say that it's really new and that we are experimenting with it, and we think it's potentially very, very interesting and important and a very useful process to start to work with digitalization in the health sector.
Thanks, Annabelle. Jay, you have your hand up, so please go ahead.
Should we say, I mean, Since someone raised the end users, I guess you all know. I mean, once this is transformation, and once governments are seeing this as part of their universal health coverage strategy, then negative viewpoints on what's being done by end users will have a political relevance. And also, if people don't trust the system, it'll be very important. So I think it's absolutely essential to involve end users early on in any of these discussions about regulatory change or about incorporation of digital innovations at scale. And I think that's one of the messages, that there's a big difference between testing, proof of concept, or even fairly small scale or emergency response to COVID. But now, if it's going to be integrated into transformation strategies, having mechanisms of ensuring that citizens are end users are coming along with it and see it as beneficial will be important.
Thanks, Jerry. Jay, you still have your hand up, so please go ahead.
Yes, Priya. I just wanted to know, I think sending information of how to engage with the existing labs will be very helpful. In our listserv, you could post it. Following this webinar, like, you could post that how to engage with the existing labs, especially like, for example, the one in India and Bangladesh you mentioned, that is from our region, of course. So it will be very helpful to know. And then are there any plans for further labs in our region? And then, like, what is the kind of mechanism, like, if somebody wants to, like, for example, I know many of our countries and members are working on standards and interoperability labs. So that is also a part of transformation, I would say, because countries have interoperability issues and issues related to, adoption of standards. Maybe they could actually, like, tap into such labs or the methodology and actually follow it for standards and interoperability. And then how can we engage if there is a standards and interoperability lab in those countries, how they can engage with this transformation T labs, or to set up new labs in new countries, and then what kind of support is available if some light is thrown on that, not necessarily now because we are running out of time. Maybe if they can also, this answers to this or clarifications on this could also follow in the listserv, that will be very helpful. Thank you.
Thanks, Jay. I think that's a great question. We would be delighted to have transformation labs in the region. That's the whole point of this webinar, actually, is to see how others would like to engage us, like to engage this idea of transformation lab. To set the record straight, as Annabelle and Jerry said, these labs are not solely organized by us alone. We have partners who show an interest and take that ball running. And we kind of go in to kind of help them with the methodology, help them answer the question. And as Annabelle says, we don't see these as one-time engagement. They are iterative engagements, perhaps even a multi-year process. So that's how we really see these relationships. These labs are more like relationships with varied stakeholders that we actually see happening over time. So we would be delighted to, if people want to reach out to us, they can do so via AeHIN. We can, and maybe express an interest to say whether they want to do one on HMIS, on digital interoperability, on better unpacking AI, for example, ethical issues around AI, whether they want to look at, how some of the new health data laws that have emerged in India are actually being evaluated and assessed. Those are things that, we would be delighted to kind of work with them and see how we can actually engage and maybe organize a lab in any one of these countries in the region that AeHIN operates. In terms of funding, most of these labs actually are co-funded. So, for example, for the CCAMP lab, CCAMP is going to raise some of that funding and basically run it, and then we come in and we contribute towards that. So a lot of these are co-funded opportunities. We raise funds together and we organize the labs. And so the motivation often comes from the people who want to organize the lab, want to explore a particular or experiment with a particular question or a particular idea or an approach that they are dealing with, particularly on digital transformation. And from there, we kind of work up together. And the same with HealthX. They are also co-funding and co-subsidizing this lab, and that's the way we are kind of approaching it. So we do work with multiple funders, some of whom may contribute towards the labs, and otherwise those who are promoting or want to have the labs, they also put in a little bit of money. So it's basically a collective effort in terms of funding is concerned. So I'll stop there. And Jerry, do you have anything more to add at this point?
No, I think it's good to open up the dialogue, and it would be good if we can find other opportunities to exchange ideas.
Great. Annabelle, anything from your side at this point?
No, just to thank the questions and the discussion, and yeah, looking forward collaborations and to carry on working.
Sounds good. I think we have one last question from Manisha. So Manisha, please go ahead. And I think we're almost out of time.
Yeah, sure. Thank you so much for this presentation and giving an opportunity to understand how this TLAB works. I have one question. If there has been any TLAB being formed in collaboration with a government agency, or maybe in collaboration with ministry, is there any experience as such with you, and what was the modus of operandi? That's my question. Yeah.
Manisha, I think Jerry answered that question partly. I mean, TLABs are not always need be organized by the government. They can be organized by a civil society organization that wants to deal with digital transformation and invite the government to that TLAB. So far, we have had governments involved in conversations around digital transformation as part of our consultations. In fact, the first consultation that we had way back in 2018-19 involved the Niti Aayog. And we actually brought the Niti Aayog in partnership with GE in Bangalore at their campus, where we began to try and to unpack some of this rapid innovation and digital change that was actually happening across countries. So that was one where we actually invited the government. We also invited private sector and technology actors, and actually began a series, literally began these consultations from the outputs of those initial dialogues that we had. I mean, I think it really depends. If you want to organize something with the government, with the Ministry of Health, you could reach out to us and we could work together to actually get that done. So, like I said, this is a very democratic process. It really depends on who wants to engage, who do they want to engage, and what kind of questions do you want to address around the digital transformation process. It could be around ethics, it could be around citizen engagement, it could be around any of the things that Annabelle talked about. But the important thing is that this is not a one-off process, it's an iterative one. These dialogues often address or could address a particular challenge or problem. It could also be around experimenting with using evidence to kind of influence a particular policy direction or a particular way in which digital transformation is being addressed in a particular country. So I hope that kind of answers your question. And Annabelle, go ahead.
Yeah, just want to add on that it could be that is originally an initiative of a government agency, if I understood your question. I think that could perfectly be the case, but it has but then the important thing is that this government agency work with some institution or some group that is from outside the government to really facilitate and lead the process, because ideally it shouldn't be the agenda, it shouldn't be driven by any particular sector. And that's something that I mentioned at the end of the presentation, that in terms of this having a real impact to unblock some of the changes, it's very important that it's perceived as a process which is not following the agenda of one particular group, but really working for precisely unblocking processes of change. So even if it's organized by government, or it could be, originally the idea could be coming from any sector, but what is important is then that the process is facilitated by somebody that is really completely outside is very difficult, but at least kind of really part of the system that we are working with, because it's important that you have somebody from outside to really help to move the agenda in a way that is not linked to one specific set of actors. And government is one.
So I hope that
Thanks.
answers your question, Manish. Great. So I think that kind of wraps it. If there are any more questions, please write to us. We have our emails, and please feel free to reach out to us if you're interested in organizing a lab in your region, and we'd be delighted to work with you, fundraise with you, and see how we could help make it actually happen. So once again, I'd like to thank AeHIN on behalf of all of us, including Annabelle and Jerry, for this wonderful opportunity. And Jay, over to you. Look forward to keeping in touch with this wonderful group of digital health innovators and actors.
Thank you, Priya, Jerry, and Annabelle. And this has been very helpful. I think we can follow up this webinar with more information about the T-Labs and how to engage, as I mentioned. And then also, we would like to also quickly mention about the AeHIN General Meeting that's going to happen next month, in just about a month from now. Over to you, Chai, if you want to make any announcements on that. And we are eagerly looking forward for some of you who can actually join us in person. Otherwise, like, you can also join virtually. Thank you.